So he'll be watching this by recording later, so I'll just record the part where I talk so that I don't put you on video if you don't want to be. I'm Dr. Betty Leslie. I do live in Kane, Pennsylvania, if you've ever heard of that. I've been trying to explain to a few people where that is. It's 3.5 hours north, just below the New York State border, and about 100 miles east of Lake Erie in the forest. Lots of outdoor activities. So I have taught for University of Pittsburgh Bradford. That was my first teaching experience 12 years ago. I loved it, love undergraduate. And so that was really the impetus behind me wanting to do this study. Right now, I am currently working remotely for a college in South Dakota. That's why my name tag says Aberdeen, South Dakota. And I'm creating an online nurse educator and family nurse practitioner program. We just got approval, yay. And we're going to be starting soon, so I'm busy building curriculum. I do love clinical curriculum and all curriculum, so I'm one of those rare breeds. So without further ado, I'm going to go ahead and speak here. And the name of the study was The Relationship Between Clinical Curriculum and First-Time NCLEX-RN Success, a Correlational Study. So just an overview, I'll take you through the whole journey very quickly, problem, purpose, and we're going to try to spend a little more time on significant results and recommendations. You know, when you start a research study, they always tell you that what you think you will find is not often what you do find, and I found that that was the case here. So the impetus behind this study was, what can we do better to educate pre-licensure students so that they are more effective in clinical curriculum? I know that we've been guilty of adding on content time and time again. We've been told the last few years by all the nursing bodies we need to do something different. And I think the same is regarded with clinical. We are adding more residencies across the nation. They serve a purpose. But what can we do as nurse educators to make our clinical curriculum better for our students? So that was really what my thought was when I went ahead and did this study. So the problem is that there is a disconnect between the didactic and the clinical component of the curriculum. And of course, Benner and her co-workers, researchers, also studied this and have spoken about that. And we need to be more purposeful in that. And in fact, we still are not entirely sure what makes up good clinical curriculum in nursing education in the United States. And doing the review of the literature, I found that to be true and was still kind of surprised at just how little research there is with regard to the clinical component of our curriculum for nursing education. So I wanted to fill that gap. So the purpose was to determine if there was a relationship between the design and implementation of clinical curriculum and associate degree nursing programs in the northeastern United States and NCLEX-RN pass rates. So why associate degree programs? Well, I've taught in them on ground face-to-face, and the original study was actually on baccalaureate programs, and so they can be accredited by different accreditation bodies. At the time of this study, there was only one accreditation body, which really kind of made it simpler for comparison reasons. So that was part of that reasoning. So we have a lot of barriers facing nursing education today. In the last few years, we've been asked to completely redo nursing education. We're seeing a lot of flipped classroom designs. In fact, they've asked us as speakers to do that today. We've kind of gone back to concept-based curriculum, which I understand we really did do a number of years ago. But we really face some barriers. We have 2.8 million RNs. We're the largest healthcare profession, but we are supposed to educate 1.2 by 2020, and that's just around the corner. So in order to expand our capacity for enrollments, which we're being asked to do time and time again, we need to change things, and we need to do that based on research, of course. So the research method and design. Dr. Martha Tonikawa's survey was used. She originally used this and developed it for baccalaureate programs out in the Midwest. And with her permission, I did change the name so that instead of saying baccalaureate, it's associate degree. So for short, it's CAMP, meaning the Clinical Educational Associate Programs in Nursing. So there were 132 programs in the northeastern United States, and that's defined by the U.S. Census Bureau, and that includes all the states from Maine, Connecticut, Vermont, New Hampshire, New Jersey, New York, Rhode Island, I'm sure, I feel like I'm forgetting what, there are 9. So I'll show you a map of that in just a moment. And what the survey looked at was the independent variables included clinical categories, clinical hours, so the numbers where they're placed in the curriculum, clinical sites, and then factors that influence the design of clinical experiences, characteristics of the faculty, meaning how long they taught, are they adjunct, are they full-time, and then evaluation of student clinical performance. So the questionnaire was quite long, so I did shorten it just a little bit with Dr. Martha Tonacala's permission. And so items that were in the public domain, such as the NCLEX pass rates, were removed from that because I wanted that to be factual instead of just self-reporting. And it also helped to condense it a little bit. So it actually took 10 minutes less, and the survey was administered online. An email link was given. Sorry, this, there it is. Couldn't see my mouse. So specifically, the research questions were focused on the design, the implementation, and then faculty knowledge of the test plan. So research question 1 was, what is the relationship between the design characteristics of the clinical component in the curriculum and NCLEX-RN success rates in nursing programs? And then research question 2, what is the relationship between the implementation characteristics of the clinical component in the curriculum and NCLEX-RN success rates? And lastly, research question 3, what is the relationship between nursing faculty members' knowledge of the test plan and NCLEX-RN success rates in nursing programs? So here are the 9 states, and you can see the number of respondents. Hopefully it is a little light. So Connecticut, there were respondents from every single state. Pennsylvania had the most, so that was kind of nice living in Pennsylvania and having the biggest response rate. You wouldn't think it would matter since it was administered online, but for some reason we were well represented. Of course, we do have a lot of associate degree nursing programs. And 55 respondents total. Now, 3 of those were duplicates, even though SurveyMonkey was set to not allow that, but I think they started on one computer and then finished on another, so those were removed. And then, according to my criteria in IRB, I couldn't use anything that was considered incomplete, so, and that was not specifically defined, so if they were incomplete in any way, they were dismissed. So all in all, 24 completely thorough surveys. Now I did give out randomly a $500 gift card, a Visa gift card to one program that was randomly drawn if they completed it. So that was an impetus for hopefully taking the survey, and people were interested in that. And I was really delighted that a program up in Connecticut that was struggling got that, and they were just redoing their skills. So that made me very happy. They were happy too. So I did not submit my slides prior to, mostly because I changed them up until the moment of. And so if you want to text me and ask me for the slides or get my email at the end, you can do that. And so I just wanted at this point to give you my cell phone number, and it is on silent, you don't have to worry. So that's 814-598-1167. And so if later you want to ask me for those slides, I'd be happy to send those to you. And I'll give you my email address at the end for any points of discussion. So the data collection process took place over 4 weeks. The email survey was sent out, and there are always things you don't anticipate, such as emails bouncing back, or directors going to work for a different school. Boy, their name sounds familiar, but they're not working for this university now, they're in this state, still working for an associate degree program, and you want to figure it out fast because you want that high return rate. So, different things like that. And then I sent out an email reminder at week 2. Honestly, the week 2 reminder seemed to boost that response rate more than the week 3 reminder. It seemed like by week 3 their attention had gone elsewhere, and there just wasn't a good response. And then at the end of week 4, the survey closed, sadly. So, looking at research question 1 and the design, these items were measured by point by zero correlation and descriptive statistics. And also part 4 of the CM survey. And part 4 included curricular influences for the design and asked what degree, some degree, no degree, some influence, no influence, or major influence items had on the clinical curriculum. So the items that were included in here were things like accreditation, State Board of Nursing regulations, clinical agency and faculty feedback, student feedback, clinical evaluations, and administrators of the School of Nursing. So the dependent variable was the NCLEX-RN pass rates, the average pass rates provided by the National Council of State Boards of Nursing for the preceding 3 years, so those averages. So that's how RN success on the NCLEX was defined. And the point by zero correlation was conducted to determine the strength of the relationship between NCLEX-RN success in each variable of the design characteristics. So regarding the implementation characteristics, this was measured by parts 1, 2, 3, and 4, or pardon me, 5 of the survey. And this included nursing courses with clinical content, so the hours spent in didactic and also in clinical, the distribution of clinical hours, types and frequency of student clinical hours, such as long-term care, acute care, and faculty teaching clinical courses, so such as the number of full-time and the number of adjunct. So some interesting findings. And then research question 3 was the faculty knowledge of the NCLEX-RN test plan as related to NCLEX-RN pass rates. A multiple regression was conducted there. Now for research question 3, I found no statistical significance. So unfortunately nothing was found for that question. So I'll focus on the findings for research question 1. So once again, what I thought I would find, just so you can get a look into where my thought process was, I really thought I'd find where clinical hours associated statistically with NCLEX-RN success. And I thought that before I did my review of the literature and during this process, and I just always had that in the back of my head. Because originally when the survey was done with the baccalaureate programs, long-term care did correlate significantly with NCLEX-RN pass rates. That didn't happen this time around, and not in my findings. So what I did find was, if programs said that accreditation had a large influence, a moderate to large influence, then they statistically significantly correlated with NCLEX-RN pass rates, meaning they help to boost RN pass rates, which does help to verify what accreditation bodies are saying, that they provide quality standards that are research-based, and if you follow these, it should positively impact your program. So the logic is there. So as well as accreditation, administration influence positively correlated, which the more I thought about it, the happier I was with that finding. Because at least in the programs that I've taught in, sometimes administration, meaning at large the college or the program's administration, puts certain expectations on the nursing programs. And probably at some point you have felt that as well. And what this shows is there was a significant relationship between whether or not administration had autonomy and influence over their own curriculum. So I was happy to report that. And that actually accounted for 17% of the variability, and accreditation accounted for 18% of the variability, which was very significant. I'm sorry, it's hard to find this little mouse. It doesn't show up on my screen. Here it is. Okay. So with research question 2, the implementation characteristics of clinical curriculum, I was surprised to find that whether or not a program assesses clinical faculty competency significantly positively correlated with NCLEX-RN success. Now, many programs assess clinical faculty competency as far as asking students to evaluate their faculty. However, that's not what this is measuring. It's measuring whether or not the administrators or peers assess a faculty's competence in the skills. So the research did show that if a faculty practices in clinical, not just teaching clinical, then their skills are more current and it does positively impact NCLEX-RN success. So I thought that was an interesting finding. Also, this was a finding that I was a little nervous to find, but this is what the research showed. 2 factors significantly negatively correlated with NCLEX-RN success, meaning that they decrease NCLEX-RN success. And those were if the clinical faculty has an earned doctorate in a field other than nursing, and also the number of clinical faculty who are licensed as nurse practitioners. I know, I know. Imagine me, I really, would rather not report on that in a way, because I don't want to, But again, once I looked into that, it makes sense with regard to the fact that they're teaching at a different level. And it also makes sense with regard to what the accreditation bodies say, that it is best if faculty have a master's degree in nursing education because they've learned how to teach. And so there are great implications for this, meaning that we need to mentor nurse practitioners into the faculty role. We need to do a much better job of that. We need to provide faculty development for nurse practitioners and for those nurses who have earned doctorate in a field other than nursing. Honestly, I wouldn't have thought to put that on this survey, but again, I was using Dr. Martha Tonicola's survey, and I thought, are there faculty with an earned doctorate in a field other than nursing who are teaching clinical? And there are, and correlated those with the types of clinical categories, and they're mostly teaching in community settings, such as psychiatric. So we need to assess their skills as well. So we need to do a better job at getting them, I guess, up to date on skills and feeling more comfortable in the clinical setting. Yes, that strongly that was a negative correlation. Yes, specifically the number of nurse practitioners teaching in associate degree programs.
The more nurse practitioners, the lower
that is correct. So yeah, so the more nurse practitioners in the program, the lower the NCLEX scores were. And that's not to say we should not use nurse practitioners. I'm absolutely not saying that. What I'm saying is we have obviously not been doing a good enough job mentoring them from that practice setting to teaching undergraduate nurses. So we've been remiss in that. That's an area that we need to get better in that. And so, let me look at my data here. So only one of the 5 programs below the NCLEX-RN, let me go back through here just to recap, because I thought this was interesting as well. As far as administrators, only one of the 5 nursing programs below the NCLEX-RN success rate reported that administrators had a major influence. So you can see that it's sort of like saying the converse is true. And then also 3 of the 5 nursing programs below the NCLEX-RN success rated the accreditation recommendations to have no influence. So, and then 4 out of the 5 respondents whose programs were below the national 3-year NCLEX-RN average indicated that they do not assess clinical faculty competency at all in any capacity. It's very, again, these are not findings that I expected to find, but they were quite interesting. We had a great discussion afterwards about my research. So the clinical faculty characteristics, the majority of the programs indicate that most of their clinical faculty had an earned master's degree, so 15.75. Now the average teaching years for full-time faculty, clinical full-time faculty, was 14.58 years. I love teaching in clinical, so I was really happy to find this. But that's 1.5 times higher than the amount of years of teaching experience for adjunct faculty. So they have a lot more teaching experience. And what I found is the adjunct faculty taught 38% of clinical, so that's a considerable amount. So once again, really speaking to mentoring and faculty development. So the multimodal regression was used to determine if clinical faculty credentials correlated with NCLEX-RN success, and 52%. So I told you it was statistically negatively significant, but it also explained 52% of the variance. So right, that is very powerful. So NCLEX-RN success did decrease when there were more clinical faculty certified as nurse practitioners. 71% of the programs indicated that they used nurse practitioners, which is fine. And 14 programs used 5 or fewer nurse practitioners, and 5 programs used 7 to 15. So there are also a few statistically significant areas which were additional findings with regard to my theoretical framework of Kolb's experiential learning cycle. Not so much in the concrete experiences, which really measures whether or not students are getting those hands-on hours, and they were in lab, and that correlated with physical assessment and acute care, so that was really expected. But where it seemed to kind of be lacking was in the second stage. So this is observational. So the research showed that there really is, we need to be more intentional about putting observational hours across the entire curriculum instead of just in areas like medical, surgical, and acute care, because students need to reflect on their learning, and that helps them to really cement that understanding. Now, in the third stage of abstract conceptualization, this is where clinical conferences are used, and it was very heavily focused on medical surgical. So if we could maybe add those across the curriculum so that students connect that, because remember the disconnect comes between didactic and clinical, so we need to make that connection for them. In clinical conferences, that's a great place where we can do that. We can say, okay, this is what you're learning in classroom this week, and here's how it relates to what you just saw and practiced. So we have to be very intentional about that. And then lastly, with the active experimentation, these are the hands-on clinical hours. So there was a negative correlation between direct hands-on clinical and fundamentals. So we don't have very many hours for hands-on and fundamentals, which I kind of thought we'd find since we do a lot of skills in that area. But we might want to do more. And then there was a positive correlation found between direct hands-on clinical hours in the entire nursing major in acute care. So we have a lot of hands-on hours there. So maybe just a redistribution of hours across the curriculum so that we're really hitting the reflection and the abstract conceptualization, so we're helping them with those higher order thinking levels. That's where I wanted to go. Significance of the results. So really, with regard to nursing education and leadership, nurse administrators need to have the autonomy and be provided with the resources so that they can get, recruit good, effective nurse educators and to retain them. So if they have the autonomy and resources to increase salaries, for example, right? I knew that would get a few, but we do need to. We really do, because we have a nationwide shortage of nurse educators, which is far worse than the nursing shortage. So we need that autonomy, and hopefully research like this does to help justify that. In accreditation influence, the National Council and State Boards of Nursing said a few years ago that they would like it if all state boards mandated accreditation. Some states have tried to follow suit in that. Minnesota is one. And then assessing clinical faculty competence. If we have a simulation lab, that's one of the greatest ways we can do it. I remember Pam Jeffries talking a few years ago, and she said that about bringing faculty in at the beginning of the year and just going over their skills, because we can sit and talk for 5 hours about how to do a blood pressure correctly, but so maybe we should take that and really be purposeful about going to the lab and trying to do things similarly so that it's not so varied when we go into the clinical setting for the students. So that's all I have for my speaking. My entire dissertation is on ProQuest, and you can email me to get that or text me, and I'll give you my email address. And then I do have an activity that does involve my findings. So my email address is Betty with a capital B, B-E-T-T-Y, Leslie, capital L-E-S-L-I-E, at presentation.edu. And I can also email you my slides if you would like. So, oh goodness. We're all set.